Hello and welcome to WHI Women's Health Issues, your channel that talks about health issues affecting mostly women, the causes, the symptoms, and treatment methods if possible. So, today we're going to talk about fibromyalgia. Fibromyalgia. So, what is fibromyalgia? Fibromyalgia or fibromyalgia syndrome is a condition that causes aches and pains all over your body. People with this symptom often experience other symptoms such as extreme tiredness, feeling sleepy, moody, or memory problems. So they are saying that people who have fibromyalgia experience symptoms such as memory problems, moodiness, sleepiness, and being extremely tired. Fibromyalgia affects more women than men. The pain, extreme tiredness, and lack of sleep that fibromyalgia causes can affect your ability to do work or do your daily activities. Treatment can help relieve pain and help prevent flare ups of these symptoms. So, who is susceptible to getting fibromyalgia? Who does it affect the most? The fibromyalgia affects as many as 4 million Americans ages 18 and older. The average age range at which fibromyalgia is diagnosed is between 35 and 45 years of age. But most people have had symptoms including chronic pain that has started in earlier life. Fibromyalgia is more common in women than in men, so more women suffer from this condition than men. Are some women more at risk of fibromyalgia? Fibromyalgia is more common in people who have obesity, who smoke, who have another rheumatic related to the joints conditions such as rheumatoid arthritis or lupus. It also is more common in people who have a close relative with fibromyalgia. Researchers think a gene or genes may cause pain when pain will not normally happen. It is also common in people who have had trauma to the brain or to their spinal cord. Physical trauma may come from an injury or repeated injuries, illness, or an accident. Emotional stress or trauma, such as post-traumatic stress disorder, may also lead to fibromyalgia. So, what are the symptoms of fibromyalgia? Chronic, long-term, widespread pain is the most common symptom of fibromyalgia. You may feel pain all over your body, or you may feel it more in the muscles you use the most, like in your back or your legs. The pain may feel like a deep muscle ache, or it may throb and burn. Your pain may also be worse in the early mornings. Other symptoms of fibromyalgia may include, but are not limited to, extreme tiredness called fatigue that doesn't get better with sleep or rest, cognitive and memory problems, trouble sleeping, mood problems, morning fatigue, muscle fatigue, causing your muscles to twitch or cramp, headaches, irritable bowel syndrome, painful menstrual periods, numbness or tingling of hands and feet, restless leg syndrome, extreme sensitivity to temperature, sensitivity to loud noises or bright lights, anxiety or depression. Women with fibromyalgia often have more morning fatigue all over their bodies and irritable bowel symptoms than men with fibromyalgia. So, what causes fibromyalgia symptoms to flare up. Fibromyalgia symptoms can happen without warning, but certain events may trigger flare-ups, including hormonal changes during the menstrual cycle or pregnancy. You may have more trouble sleeping, more widespread pain, or headaches just before your period when your hormone levels drop. Your periods may also be more painful if you have fibromyalgia. Stress. Chronic long-term stress may raise your risk of getting fibromyalgia. Also, short-term stress, such as work stress or stressful events such as the death of a loved one, can trigger flare-ups in people who have fibromyalgia. Also, changes in the weather. Some women report pain with changes in barometric pressure, such as when the temperature drops from warm to cold or on hot, humid days. So, all this talk about fibromyalgia. What causes fibromyalgia? Researchers are not exactly sure what causes it. Genetics may play a role. Studies also show that the brains of people with fibromyalgia may not process pain in the same way as people who do not have it. Lower levels of certain brain neurotransmitters, such as serotonin or norepinephrine, may cause you to be more sensitive to pain and have a more severe reaction to pain. Imaging studies of the brain show that people with fibromyalgia feel pain when people without fibromyalgia do not. Some medicines prescribed to treat fibromyalgia try to bring the levels of those neurotransmitters back into a normal balance. So, how do doctors diagnose someone with fibromyalgia? How is fibromyalgia diagnosed? Your doctor will ask your symptoms and your medical history. There is no lab test for fibromyalgia. Instead, your doctor will make a diagnosis based upon two criteria. One, you have experienced widespread in many places on the body pain for longer than 3 months. Two, if you have other symptoms such as fatigue, sleep problems, and memory problems. You may have to see several doctors before you get an actual diagnosis. One reason for this may be that pain and fatigue, the main symptoms of fibromyalgia, are also symptoms of many other conditions such as myalgic encephalitis, chronic fatigue syndrome, rheumatoid arthritis, and lupus. Doctors try to figure out if fibromyalgia or another health problem is causing your symptoms. So, how is fibromyalgia treated? Treatment for fibromyalgia may include medicine to treat your pain. The Food and Drug Administration has approved 3 medicines to treat fibromyalgia. These 3 medicines are pregabalin, duloxetine, and milnacipran. So those are pregabalin, that is pregabalin, duloxetin, that is duloxetine, and milnacipran, that is pronounced milnacipran. Your doctor may also suggest pain relievers or antidepressants to treat certain symptoms or to prevent flare-ups. Talk therapy is also another treatment method for fibromyalgia. Counseling sessions with a trained counselor can teach you different skills and techniques you can use to better control your pain. This type of therapy can either be one-on-one, or in groups with a therapist. Living with a chronic condition like fibromyalgia can be difficult. Support groups may also give you emotional support and help you to cope. So, what steps can you take at home to relieve your fibromyalgia symptoms? You can take the following steps at home to relieve your symptoms. Getting enough sleep. Most adults should try to get 7 to 8 hours of sleep every night. But fibromyalgia may make it hard for you to fall asleep and to stay asleep. Your doctor may recommend going to bed at the same time and getting up at the same time every day. Your doctor may also recommend not drinking caffeine, alcohol, or eating spicy meals before bedtime, not taking any naps in the day, doing relaxing activities such as listening to soft music or taking a warm bath that prepares your body for sleep. You can also do stuff to reduce stress. Stress can trigger a flare up of fibromyalgia symptoms. Strategies such as meditation, massage, and talk therapy may help. Getting regular physical activity. Pain and fatigue may make exercise and daily activities harder to do, but studies show that for many women with fibromyalgia, regular physical activity can reduce pain. Any activity, even walking around your home or neighborhood, can help to relieve your symptoms. Start at a very low level and slowly increase the amount of activity you do. Trying complementary or alternative therapies. Some women say their symptoms get better from trying complementary or alternative therapies such as physical therapy, a massage, a myofascial release therapy, acupuncture, tai chi, yoga, and relaxation exercises. So, will fibromyalgia get the better of you? Will it get better over time? Fibromyalgia is a chronic disease that is often a lifelong condition. But fibromyalgia is not a progressive disease, meaning it will not get any worse over time. It also does not cause damage to your joints, muscles, or organs. Taking steps to treat fibromyalgia can help relieve your symptoms. So, how does fibromyalgia affect pregnancy? Most women with fibromyalgia have no problems getting pregnant, and some women report that their symptoms get better during pregnancy. But for some women, fibromyalgia can cause problems during pregnancy. Your symptoms may flare or get worse, especially in the first few months of pregnancy. Also, some normal pregnancy complaints, such as fatigue, stress, and mood swings caused by changing hormones, may be worse for women with fibromyalgia. Talk to your doctor about medicines you take to treat fibromyalgia, as they may cause other health problems for you or your unborn child. So, will you still be able to work if you have fibromyalgia? Usually, most people with fibromyalgia continue to work, but you may have to make changes to do so. You can cut down the number of hours you work, or switch to a less demanding job, or adapt a current job. If you face challenges at work, an occupational therapist can help you design a more comfortable workstation or find more efficient and less painful ways to do your job. If you are worried about your employer, federal laws protect your rights. However, if you cannot work because of your fibromyalgia, you may qualify for disability benefits through your employer or the Social Security administration. So what is the difference between fibromyalgia and chronic fatigue syndrome? Myalgic encephalomyelitis or chronic fatigue syndrome and fibromyalgia are similar in many ways. A person can have fibromyalgia and myalgic encephalitis, chronic fatigue syndromes, both at the same time. Both conditions have pain and fatigue as symptoms, but the main symptom of fibromyalgia is pain, and the main symptom of chronic fatigue syndrome is extreme tiredness that does not get any better with sleep and rest, which is also referred to as chronic fatigue. So there ends this read up on fibromyalgia. So if you found what we have mentioned helpful, you can leave a like on this video. You can subscribe to our channel. The link to subscribe is in the description below. So until the next time, this is Women's Health Issues, your channel that talks about health issues affecting mostly women and their causes, symptoms, treatment methods. So until the next time, bye y'all. Subscribe.